Greetings. This is Chris Moyer, and I'm coming to you from Denver, Colorado. This is the Massage Therapy Journal Club, and I'm joined by Terri Rowan, coming to us from Guelph, Ontario. How are you doing, Terri?
I'm doing okay.
Thanks for joining us. Let me tell you a little bit about Terri. She's a registered massage therapist working in Ontario with an interest in helping people understand the how and why of manual therapy. She's a recreational runner with academic interests in training and recovery and also in helping patients maximize training resiliency. In addition to that, she teaches infant and baby massage to help caregivers bond with children through touch. She's a graduate of ICT Kakawa College in Toronto, holds a general certificate with the College of Massage Therapists of Ontario, and is a member of the Registered Massage Therapists of Ontario. She also has bachelor's degrees from Trent University and from Queen's University. That's quite a background, Terri.
I guess so.
It's a lot
I
of
don't know.
training, a lot of varied interests there. So
Yeah,
pretty neat. I mean, you've got the athletic part, you've got the infant massage, you've got the background in education. I just learned talking with Terri before we went live that she has some experience teaching Latin in high school, and that's actually relevant to what we're going to talk about today, since we're going to be talking a little bit about the nocebo effect. So that's Latin,
it is.
right?
It is.
Right. So what does that? Okay, so let's start there. What exactly does that mean in Latin?
Oh, why? It's in the article, and now you're testing me.
No, you're the Latin teacher. I'm not gonna, come on now.
My Latin teacher would be horrified if she knew that I didn't know that right off the top of my head. It means to harm. So,
Yeah, you're being too
yeah.
modest. You know that. So we are looking at this article today entitled "Just Breathe Normally," and it is by a psychologist named Paul Schenk, and it appeared in the American Journal of Nursing in 2008. And Terri helped us select this article because of an interest in communication, particularly in clinical communication. And this article outlines some of the ways in which clinical communication might go wrong, and how to avoid having that happen. This is a little bit different from our other episodes. Our other episodes up till now have focused on research articles, and here we're focusing on a professional practice article, which I think is a good extension for this feature. How should we start discussing this, Terri?
What would you like me to say to start?
I don't know. We can jump in wherever we want. I mean,
Sure.
got a little outline of the article. I mean, he introduces this concept of language traps, is what he's calling them. He says he's identified 6 different ways that he thinks clinical dialogue can go wrong, specifically ways in which the treatment provider might unknowingly um, cause negative outcomes in a patient. And he attaches this to the nocebo effect, which would be the other side of the coin of the placebo effect. We're all aware of the possibility that elements of treatment that are not necessarily the active ingredient can still influence a patient or a recipient. When that happens in a good way or a favorable way, we tend to think of that as the placebo effect. Um, I have to do it because you told me you're a Latin teacher. What does placebo mean in Latin?
Oh, that it's from the word to please.
Yeah, yeah, I shall please, something like that.
Yeah.
So
Or
if the
placcio, I
treatment,
think.
pardon?
Placcio, I think would be the verb. I please. Yeah.
Wow, look at this. So when the inadvertent effects or when the contextual effects, and you and I might, we can go on a tangent if we want to talk about how placebo and nocebo effects should even be defined, because I have some opinions on that. I'm sure you do too. But
Yeah,
he
and
goes
it's
on this.
was one of the things I actually really liked about this article was, to be honest, I didn't know a lot about the history of nocebo, like what it actually really did, what its true definition was, or where it had come from, or even the article did a good job of laying out, here are sort of 3 different ways that this could be a contributing factor, which was not detail that I think I fully and completely understood at the time. So that was an interesting
Good, good. Yeah, let's say what those three ways are. He says he introduces the concept of the nocebo effect, and I'm actually going to add a piece of information here. I'm terrible
Sure.
at self promotion. I should mention the article we're discussing, you can access it through my Patreon account. There's a link to my Patreon account in the description below the video on YouTube. So you can go there and you can read this article. It's very short and easy to read. While you're at the Patreon site, if you're feeling it, you can become a patron of this feature. So there is the self promotion. And in this article, he says that there's three ways that a nocebo effect can happen. He says it can happen by a provider sending a negative message to the patient or recipient, by a patient in their social milieu receiving a negative message from another patient, or by a patient receiving a secondary gain. Secondary gain. Is that something you're familiar with, this concept of secondary gain?
Yeah, and that was the one that I didn't had never really factored into as a nocebo. I think I just thought of it as something separate and distinct from that.
Yeah, I'm with you. It's not the first thing I think of when I think of
Mhm,
nocebo effects. But then when he mentions it that way, it's kind of like, oh, I can see that fit.
mhm.
And for viewers who are maybe not familiar with the concept of secondary gain, this is the possibility that when someone is sick or injured, obviously you don't want to be sick or injured. However, in some cases, you benefit in certain ways by being sick or injured. So, for example, if you need treatment, you then receive attention from people. People may need to do things for you because you're currently unable to do them for yourself. And these serve as rewards. And in some cases, it's possible that these secondary gains can cause the person's illness or injury to be extended, or at least their behavior of the behaviors that go along with being sick or injured might be extended. That can be a little bit of a controversial topic, but um, that's the possibility. So it's interesting that that might induce nocebo effects, or that yeah might reinforce a nocebo pattern. But in the current article, he's focusing on the first of these, that a treatment provider in communicating with a patient or recipient might say things, including inadvertently, unwittingly, that impact the patient in a negative way. You agree with that that's what he's focusing on?
Yes, yeah.
Is that right? Okay. So you know what else was interesting is he mentions, that he does clinical hypnosis and he draws from his experience on hypnosis a couple times in the article. Did you find, how did that strike you, the possibility that there's insight to be gained from that?
For me, it was a little bit, I don't know if off-putting is the right word, but it was part of probably the one part of the article that I was like, I don't know enough about clinical hypnosis, I guess, to feel like it was a positive contribution to the article for me.
Okay.
I don't know enough about the evidence behind clinical hypnosis. And I had a hard time, maybe because of that, not having that background knowledge, I had a hard time making the connection between some of the stories that were, or the tidbits that were being shared um, from hypnosis-based sessions. The the link to the rest of the narrative was kind of tenuous for me, I guess.
I can see how that would be possible, that it would strike you that way. I'm a psychologist, and I'm not trained in clinical hypnosis, but I've worked alongside people who are proponents of it and who do it. Um, my way of thinking about clinical hypnosis is that it is just a particular technique for persuasion that maybe works well with some people. I think there might be some interesting links actually between massage therapy and hypnosis, in that both are techniques that are, well, I'm going to overgeneralize now with massage. Massage can be done for many reasons and in many ways. So I'm going to generalize here. I mean, both are techniques where um, relaxation might be emphasized and an internal focus might be promoted, and a kind of persuasion is taking place where the person receiving treatment is being encouraged and persuaded, often in a gentle way, to experience what's going on and to kind of go with the flow in the present moment. And in these ways, I think there might be some interesting parallels between hypnosis and massage. Does that line up with the way you think about massage, or would you
Sure.
see that
And
very
I
differently?
would say it's probably not the first time that I've had a personal private thought about whether or not it might be interesting, for instance, to play hypnosis tapes in my massage room, like what the effect of that might be. It's certainly crossed my mind on more than one occasion as to what that result might be. Obviously, not something I'm about to make my patients guinea pigs of, but I have certainly had that thought
That
for
is a
sure.
really interesting thing.
An interesting
I've
study.
never, yeah, it's really interesting. I've never thought about that possibility that, how, I mean, take it even further. I'm now imagining like a laboratory study in which massage recipients are under hypnotic suggestion. I wonder how that would differ from other massage. I wonder if it would enable people to be even better recipients of massage, or whether it might interfere. That's really interesting to think about, because I think the ability of massage to induce meditative or even trance-like states is a really interesting topic that I don't think has
I
been
also
explored very.
wonder if the flip side would be interesting as to whether or not people would be better recipients, excuse me, better recipients of hypnosis while receiving
Mhm.
massage.
Yeah, yeah, or right
Yeah,
after. Yeah, yeah, if
yeah,
massage maybe sort of induces a bit of suggestibility, or the potential for
yeah.
suggestibility. Yeah, I think that's really interesting. Well, we
All right,
need
let's get
to.
on that.
Yeah, well, I was just gonna say, we just, if you get the money and we'll do this study, I'd be all over that. That sounds really interesting. It's always get the money. That's always the
I know,
problem, isn't it?
I
Get the
know.
money.
We got money here in Ontario. It's small, but we got it. There's a fund of some sort. Yeah,
Sounds good. Let's
it
do it.
exists.
So, so in terms of verbal communication, which is the emphasis of this article, um, what what uh, what made a particular impression on you? Like, what about that part of the article was notable or interesting to you? Why don't we go that way?
Uh, Sorry, what do you mean? Like what a particular? Sorry, I just wasn't sure what you were asking.
Was there an anecdote, or were there one of the, he identifies sort of the six different language traps? Were there any of those that
Yeah,
were particularly interesting, or that you've seen in practice or among colleagues?
I sort of went through them, made a little bit of a few notes about each one of them, and a little bit about their applicability to me or to my practice or even massage as a whole. I felt like there was a few that were useful and a few maybe that weren't so useful. Um, I think that when we're talking about language, I feel like it doesn't pertain quite so strictly, at least in my practice, to the act of massage. I don't. There are a few moments during which I might vocalize to someone during the act of massage that might contain some of these traps, but it's usually more in the pre, in an intake interview or in a post treatment interview where these might become more of an issue. And I think that that was one of the things that I started to think about a bit more strongly was especially around this idea of creating the anticipation or the anxiety when you say things to patients around, that this might be uncomfortable or this might, right? That was the thrust of one of those traps, was setting people up to feel anxious about an intervention. And I was interested in that more from the perspective of how that applies when you're trying to give informed consent to a patient about an intervention that you're about to undertake. Because part of our informed consent process involves making sure that patients understand a risk or a side effect of receiving a particular intervention. And so how is there a way to go about allowing that patient to understand the risk or a side effect without inducing this potential anxiety around this intervention?
So I agree. Everything you're saying kind of lines up with the way I was thinking about this too. In fact, without even sort of examining it, I was thinking a lot of this would apply to what happens before massage and what happens after massage. That during the massage, this stuff is probably not as relevant because you're not going to frequently be talking, although there might be specific exceptions. So that all makes sense. So, thinking about an intake interview or thinking about the instructions or just banter that you have with someone before the massage starts, there's all kinds of opportunities there to, um, make mistakes in terms of language. And now the part you mentioned, I wonder if you can give a specific example of that. You're mentioning that, there's an emphasis in Ontario on informed consent, and that the way that you approach that, there's the potential for inducing nocebo effects if one's wording or delivery isn't good. Could you maybe give us an example of how this might come up?
Sure. Like we have a template here for informed consent that we're taught as students, which some of us later on in our practices perhaps become either A, more sloppy about it, or B, if we don't become sloppy about it, we might become a bit more compact about it in terms of how we deliver that to a patient. But like I said, a portion of that is that we are expected to convey a side effect and a risk, or
But
about the.
could you give a specific example of a side effect or a risk that a recipient would need to be informed about?
Sure. So if you were going to, it would depend on the technique that you were going to perform, because prior to that conversation, you're obviously explaining to the patient, this is the area that we're going to treat. These are the techniques that I'm going to use to perform that treatment. And these techniques carry these risks and these side effects. So it's kind of technique dependent, but this isn't one that I use personally in my practice. But if you're going to use, let's say, a friction massage technique, which is I think, quite invasive, you might need to let them know that there might be discomfort associated with that treatment. There might be bruising associated with that treatment. There might be, you could damage other tissue as a result of that more invasive technique. And so there's an expectation that you will tell the patient that.
Okay, so if a massage therapist is about to use a technique that has some risk of causing some discomfort, okay, so it might be, you described a friction technique, and we can even imagine other things where, for clinical reasons, it's determined that, working this area a little harder or in a way that is going to induce some discomfort is worth doing clinically. Am I correct so far?
Yes.
Okay, so then the issue in relation to this paper becomes how to communicate that to the person. Like, what wording should one use? What are your thoughts on that?
Right. I thought about this in terms of the informed consent, and I did not find a way out of, of this dilemma necessarily. The way that I don't know that I can specifically say related to that piece of informed consent that I can find my way out of it. For me personally, in my conversations with patients, what I tend to say to them is, and I say this to everyone that I treat, I do not believe that massage should be a painful experience. I say that to pretty much everyone that I treat. That's kind of my flip side of it, as a way of saying, I even if I'm going to do techniques that might be more invasive, I still don't think there should be pain associated with that. So I sort of maybe back my way out of it. I don't know, but I also just don't tend to use those techniques, which makes it a complicated conversation for me, right?
Right.
It's not, I don't see the value in some of those more invasive approaches. So it's not something I've even had to really think too long and hard about.
Okay, well, in that case, maybe we can think of a different example because it might be nice to put some of these into practice or to think about how one
Yeah.
chooses wording. Um, are there other things that, maybe someone's getting a massage for the first time and you've got to give them some instruction in how far to disrobe or what they can expect in terms of being dressed and draped and all those sort of things. We can imagine different ways that a therapist would communicate with the person. So let's concretize this. We've got
Okay.
therapist A who is like, there's nothing to worry about. I've done this lots of times. Just enter the room, disrobe, and get under the sheets. And when you're ready, let me know and I'll come in. So we can imagine that person. And then we can imagine therapist B who says, and I'm doing this off the cuff, disrobe to your level of comfort. You can leave as many of your clothes on as you like. And see, I don't do this. Uh, I mean,
I'd
it
say
might be
that
better to have.
you're hitting on pretty much what I would say to someone, which is I would like you to undress to whatever is comfortable for you. I will sometimes give a bit more of a directive response, or sorry, a bit more of a precise direction if I feel that they need it. I sometimes will say, if you are comfortable, um, you remove your shirt and bra, or but I'm not prescriptive about
Mhm.
that. Yeah, I think that anytime you can give somebody an instruction that is always a positive assertion rather than a negative, I think puts people in a frame of mind that.
I mean, that would seem better generally. I'd agree with that. I mean, the in terms of his traps, and maybe we should talk about those specifically. It. I'm trying to think if there are any cases in which a positive assertion could be one of these traps.
Right.
Let, let so he identifies 6 traps. He says one is using the word just. So from the title of the article, he talks about getting one's blood pressure checked, and the nurse says, just breathe normally. And he points out that this is a problem. By saying just, you kind of minimize the importance of anything else. And it makes it sound as if the thing you're asking the person to do is trivially easy when maybe you're asking them to do something they've never done before. Um, so I can imagine a massage therapist saying, go ahead and disrobe and just get on the table and I'll be in. The inclusion of just that word seems potentially negative. I mean, none of these things are obviously negative, and that's why they're traps. They're things that we might just say reflexively that serve to make the conversation more limited and more negative.
Yeah, I think with the word just, I would say massage therapists probably their most guilty, and I'm guilty of this, the most guilty way that they use this phrase is if they say to someone, just relax.
Just
They
relax.
say
Yeah.
that to patients all the time, right?
Yeah.
You're holding someone's head in your hands and you feel that that person cannot give you the weight of their head,
Hmm.
and you say just relax. And it to me is, I don't do it anymore, because one of the reasons why I was kind of also interested in this article was because I did go through a, a decent extensive period of time where I did an inventory of my language that I said to patients and was very careful about listening to myself to hear what I was saying, and then systematically trying to eliminate a lot of things out of what I was saying to patients. And I don't do it anymore because of that. So I think it's a very really condescending thing to say to someone.
I'm really
It's
glad you gave that example because now I feel like, we were working to come up with an example, and now I think we've got a really good one. So you've got someone's head in your hands, and what you would like them to do is to let go of all their muscular tension and let you hold that, but you can sense they're not doing that. Am I clear on that so far?
yes, exactly.
Okay. And by saying just relax, it implicitly tells them you're not relaxed, right?
Yes.
If you say
You're
just
you're judging them.
relax, what
You're
you're
judging them.
yeah, what you're really saying is you're not relaxed now. You're doing this wrong.
Yeah.
Please do what I'm telling you. Right? There's a whole bunch of implicit demands and a bit of negativity there. What would be a better choice of words to communicate what you intend to communicate?
And I think just quickly, I think this discussion links number 1 and number 3 together. So number 3 was try, right?
Mhm.
This idea of trying. So somebody might say just relax, but somebody else might say try to relax,
Mhm.
right? And I think that those two things
Very similar, it seems.
sometimes
Yeah.
they can be very similar, right? So I'm trying to think about what I do say. I probably use some of the suggestions from try, which is probably why I'm linking them. Is I might say, "Please give me the weight of your head." But sometimes that's what I say. Um, that's the only other version of that I can think of. Um, yeah,
Yeah, and
that's
that
probably
sounds
my
good.
way out of it. Sorry.
Yeah. I mean, I'm trying to imagine my own language in that situation. I'm trying to imagine how I could say it as effectively as possible.
Yeah.
Um,
Or can you, like, to phrase it as a question? Can you give me the weight of your head? As a way of maybe asking them to experiment with a way in which that they might make that happen. Um,
I'm wondering if it would be good to give the person like to not just say, like, to say just relax, or to say try to relax. All we've identified a bunch of problems with that, but another problem with that is that it's binary. The person's either relaxed or they
right.
aren't. It's implicit. And so you
Yeah.
might invite the person, you know, relax your head into my hands as much as you're able, or as much as you like. And that opens the door for them um, to do that. And also, it takes away sort of being judged as to whether they're not doing it enough. You're letting them,
Right.
yeah, you're telling them to whatever degree they're able to do it is correct and
And I think
acceptable.
that that was part of, um, it's not, no, it wasn't part of the yeah, it was part of number 3 of try, was also this idea that when you say to someone, try to do this, that what the person might hear probably in some subconscious way is that you think they're going to fail at it.
Yeah. Yeah, it opens the
Right?
possibility up, at least, that they're not going to be able to do it for
You're
sure.
asking me to
Yeah.
do this, but really you think there's no way I'm going to do it, right?
Yeah.
And so when
Try
you
to do
say,
this. I don't know if you'll be able to do it, but try to do
yeah,
it.
so
Right.
when you say to someone, try to relax, I wonder if that might be also what people hear is there's the judgment there of like, you don't
Oh,
think
yeah.
I'm really going to be able to do this.
Yeah, which then has the paradoxical effect of interfering with relaxation. You can actually get them going in the wrong direction because now the person's like,
Right.
am I not relaxing correctly? I thought I was
Yeah.
relaxed. Does this person think I'm doing this wrong? So yeah, so
Why
yeah,
is she judging me?
get me out of here. This is
Yeah.
yeah, all that stuff. So good, good. We're right on it. Yeah, that's so interesting. I'm wondering also, in this example we're thinking of, and I think I know the answer to this before I say it, but do you ever find yourself then encouraging and rewarding the person? So, relax your head into my hands as much as you're able. And then, after that, good, good, good job. Does that then further their ability to do that?
I find the conversation for me normally goes something like, I will encourage them to give me the weight of their head. The patient will often respond saying, I thought that I was.
Okay.
They will say something that leads me to think that uh, either they're not aware of what's going on in their body. And so I'm asking them to draw some awareness to that.
Mhm.
And then usually then that will change. So when they draw awareness to it, I will be able to sense the change. So the weight, if we're talking about someone's head in my hands as the example, I will feel that weight change.
Yeah.
What I will usually say is something like, um, I don't know, like probably, oh, okay, there it is. Like
Mhm.
letting them know that I've sensed the change, if that makes
Right.
sense. I
Yeah,
will
no, it does.
acknowledge.
That's exactly the kind of thing I had in mind. I just didn't phrase it as well as you just did.
Yeah, like I don't normally, it's not normally like a pat on the head kind of thing, like,
Yeah.
"Good, good, good for you." But it's more of just an acknowledgement that a change has happened. I can feel that the change has happened.
Right.
You've accomplished whatever it was that we were trying to accomplish. Um,
Right. Your example's way better than what I attempted to do, and it illustrates the idea I had in mind that just with a word, you can be encouraging and also rewarding the person. And it wouldn't surprise me if when you do that, if you feel even more movement in that direction, because now, I mean, that's how reinforcement of behavior works. The person gets something positive, and they tend to go more in that direction.
right.
Excellent. That's cool. So we've kind of covered just and try here a bit. Some of the others he
Yep.
mentions are the word normally. Does that one come up in massage therapy practice normally?
Um, Sometimes actually, now that I think about it, it just occurred to me now. I was looking at my notes and I didn't really have much here, but just occurred to me. I actually do use this word a bit, and I don't know if I use it in a nocebic way or not. Um, I get asked a lot, as do most massage therapists, I'm sure, about when someone is actually on the table and you're working, someone will usually want to know what it is that you are feeling, right? They
Mm,
want to know. Sometimes it's in a way that is trying to solicit, uh, I don't know. People want to know, like, does it feel really bad? Like, because sometimes
mhm,
people, it's a very negative kind of thing that they're trying to
mhm.
elicit from you. Sometimes it's just like, what does that feel like? Can you feel anything? That kind of thing. And I often have conversations with patients about what it is I'm looking for when I work because I'm not, I'm, I know enough about the limits of my palpation skills or the limits of anyone's palpation skills to know that it's not necessarily always a good, reliable source of
Right.
information. So I'm
Mhm.
always quite careful about what I say to people about that. Um, but I will usually say to them that I'm texture driven. So I'm usually just looking for a certain texture. And I will use the phrase normally at that point.
Mhm.
Normally, I expect to feel, nor don't laugh at this, but I often ask the patient first if they're a vegetarian
Oh.
because the metaphor I often use is about meat, right? That when you touch raw meat, it feels a very particular way. And when you touch cooked meat, it feels a very particular way, right?
Hmm.
And I usually look for that sink sensation you get when you touch raw meat, right? Your fingers kind of sink into it. And so that's what I will normally say. Normally, it feels like raw meat, right? So I do use that phrase occasionally when I'm not necessarily speaking about them specifically, but I'm speaking about a concept that I'm comparing to, or yeah, I can. That's the only. Sometimes, if I'm doing an assessment too, I might say normally I would expect to see this amount of range of motion in someone's neck, or normally I would expect to see someone to be able to do X functional exercise or something, right? Like
So now this
that would be
is
the,
this is interesting. This is interesting for a couple reasons. Um, I- I'm sorry. I think I interrupted you.
no,
You
it's
were
okay.
had a little more. It's okay. Okay.
Yeah.
It's interesting for a couple reasons. I mean, going to the beginning of that. You say that recipients sometimes or maybe even often want to check in with you about sort of the quality of their tissues. They want to know if you're finding the knots that they feel. And I know some people will, lose their mind over me saying knots, but
Sure.
we're talking about the way the person perceives it. So the recipient, they want to check in with you if you can feel what they feel in their body. Is that right?
Yes.
Why do you think they want to do that?
Oh, they're looking for validation usually. They're looking for they have a sensation of something. So they've come in, they have this sensation of tightness or discomfort or
Mhm.
sometimes pain. Um, they want you to it's like a form of secondary acknowledgement, I guess. Like they want you to say what you came in here describing to me is a real thing, and I can put my fingers on it, and I can tell you by feeling this that that is a real thing. And so you should not feel like this is all in your head. You
Okay.
it's a validation, right?
So they want
um,
affirmation that they're in the condition they believe themselves to be.
sure. Yep. Yeah, and this is
Yeah.
it's interesting that we kind of take the conversation this way only because well, first of all, I think one thing to note is that in the article, I don't know why I think it's a woman who wrote this article. There's something about the tone of it.
Hmm.
Um, it his beef with the use of the word normally is that you can't measure something that you're focusing on, right? If you're Am I explaining that right?
Well, I don't know. I mean, we could come at this concept in more than one way. I think in his case, he was using the example of breathing, and breathing
Right.
is an autonomic activity. And his
Right.
point specifically there was, if you ask someone to breathe normally, you've immediately created a paradox because
Changed it.
normal
Yeah.
breathing, there's no attention derived, there's no attention paid to
Right.
it. So so there's that.
And the
But
second
then you and
you
I are,
observe something, you change it. Like that's sort of the way that I was taking that.
yeah, I suppose that's true more generally, and it would be especially true for anything that is autonomic.
Right. So
Um,
when you talk about
okay,
taking the conversation in the direction of talking about someone's tissue, I sort of think that's sort of something that most people don't have a lot of control over. I mean, they do,
okay.
but they don't at the same time, right? Like they do in the sense of there are lots of things that you can do over a period of time that will change your tissue. But for the very moment on that table, there's really not much that you can do that's going to change that, right? So it seems like it's not a particularly useful thing to point out to someone, I guess, because it's not like they can spend 5 or 10 seconds thinking about something and change it. Like
So I'm thinking
it's not
about this.
possible.
I'm thinking about this from my own clinical experience, which is not massage therapy. I mean, I'm trained as a psychotherapist. I haven't practiced psychotherapy in some time, but
Yeah.
um, and I'm thinking about a parallel situation. I'm thinking about the patient who comes in and they recount their problems or their issues to you. And after doing that, they say or ask something about, that asks you to reflect on their comparison to other patients or their
Right.
severity, right? So they come in and they're like, I've got problems in my romantic relationship and my job is all messed up and I'm not sleeping and geez, doc, I must be one of your worst patients, huh?
Right.
And I, what are, I mean, I can say what my own tendency would be there. I mean, it seems to me that's a balancing act. And again, I want to emphasize, I don't know if it's the same in massage therapy. So I'm going to say what I would say and then turn it over to you and you can say how it's similar or different. But it seems to me that when a person says that, am I worse than your other patients, or it's a hell of a case I'm giving you, isn't it? Anything in that category. It seems to me it's a balancing act between honoring the fact that they've just shared their condition with you and that whether it's severe in comparison to other people or not is really of no importance. The case is theirs. So you've got to honor that they've got difficulties. And then at the same time, you need to avoid, again, inducing nocebo effects. Like, I mean, what I would never do, even if they were the most severe case I'd ever heard, what I would never do is say, you're the worst case I've ever heard, right? I'm never going to say that. So I might say, well, you've presented a lot of challenges that we're going to need to work on, but I think there's a lot of potential for improvement here. Something like that, balances acknowledging what they've shared with you, but expresses hope and hopefully avoids making them feel worse. Do you think that parallels massage therapy situations?
Yeah, I think it does. As I'd mentioned earlier, saying that I did go through an inventory of myself over a period of time. I don't even remember how long ago it was or when it was, but I did go through a period of time where I had an increased heightened awareness of what I was saying to patients, to try and weed certain things out of my conversations. And one of them was recognizing how many times I had said to someone something like, "Oh, you're right, that really does feel terrible." Like touching someone and saying, "Oh yeah, that's really." And I think that when I was newer in my career and maybe didn't have some of the knowledge that I have now, I think that I believe that I was validating them, and that was something I should do, that I should, like you say, I felt like that was my way of honoring their experience, right? About what had brought them here. And now I look back on it with horror. And it was one of the first things I did go out of my way to weed out of my interactions with patients, to not comment on that. And when people ask me when they're on the table, I often will honestly try and find a way to not answer. I'm trying to think if I've had this conversation recently with someone and what I said, but I think I tend to try and push the conversation in another direction. Whether that's to tell them, a lot of times I'll tell people that it doesn't matter. That's sometimes what I'll say to people is, it doesn't really matter what this feels like to me. It matters to me what it feels like to you, right? Is this uncomfortable? Is this an area of tenderness or pain for you? Is this the area where you feel a sensation of tightness? What I can feel is irrelevant, right? It's your body, and you're having the experience of your body. So I sort of try to steer it away that way, I think.
So if I can, I think you're illustrating an important principle, but I think it's actually even more positive than you're saying. So it's not steering them away, or that you're avoiding, or that you're not answering. It seems to me that what you're really intending to do is to keep the importance on their own experience, including a present focus. So if they say, "Oh my God, are my shoulders, can you feel how tight my shoulders are?" Instead of saying yes or no or something like that, you're saying you craft a response that emphasizes that what really matters is how it feels to them.
Yes, I would say that
Okay.
that is a good
So,
roundup of that.
Okay. So, if we were doing it right now, I'm your massage recipient and you're just getting started working on my shoulders, and I say, "Ooh, Terri, can you feel how messed up things are in my shoulders?" What would you say?
I would probably say, like, does that feel to you like the area that it is causing you discomfort, or is that the area that you were telling me about previously, or just probably get them to think less about what it is that I'm doing and more about, are you having the experience now that is why you're here, right? Yeah. Sometimes I do still revisit, not making judgments, but like sometimes I do sense something that I think is unusual, and I will still bring it up. I will say, what does that feel like to you? I still don't make it about what I've discovered. I don't sort of say, oh, that feels really not so nice there. I'll say, what does that feel like to you? And if they say feels fine, I'm like, all right, moving on. Say no more. Like, don't bring up, right? Don't fix what isn't broken, right? But
We the sixth of his traps was around expert assertions and directives, and this is actually there's a table in the article that gives examples of these.
yes,
So,
this
oh,
was
it
an
sounds like you're
interesting
eager to,
one.
yeah, you're eager to talk about that one.
Yeah, it I I didn't. I'm just looking at the article here, and I had a few comments on it that weren't necessarily super specific to massage, but um,
I can
I
think
had
of
a.
one that I'm sorry, go ahead. I was about to say I can think of an example that I've heard people say that is specific to massage
Oh,
that could go
okay.
in this table. So the table we're looking at, he shows language incorporating a negative suggestion, and then a better one with a positive suggestion. So the example he gives from medicine is, here's your pain medicine. He sees that as slightly negative because there's an emphasis on pain. He suggests that a better way to word that would be, here's some medicine to help you get comfortable. Um, I think in massage, and it might happen more here in the States than in Canada. Maybe I'm wrong about that. And I think it might happen more with new therapists than with more experienced therapists. But we've all read about or heard examples where a therapist concludes the session and they're talking with the recipient and they say, now you may be stiff for a few days, or you might feel some soreness in an hour, or you might feel some soreness tomorrow, as a way of explaining how their body might respond to massage. And that seems to me like that would fit right in this table. Um, have you heard of these? Have you
Yeah,
encountered this kind of example?
yeah, for sure. I think it's something that I don't know if it tends to be something on the way out of a massage for us here, or if it's something we sometimes cover in our informed consent when we're talking about, as we touched on earlier, risks and side effects. Is this idea that there might be this post massage soreness or whatever we want to call it. So, yes, certainly it is something that A, we were taught to address with
Mhm,
patients, and B, that people do address with patients. I don't think, again, because it's not my style
mhm,
to use either invasive techniques or techniques where I would expect that to be a result. I don't typically cover it with my patients, but
mhm.
it absolutely is something that does get done here. Um,
So, given it's a possibility, I mean,
sure.
forgetting for a moment the fact that your present style of working is very unlikely to bring about that effect, um, which is important. But I mean, let's set that aside for the moment and let's realize that some work might induce some soreness, and it's always a possibility, even with gentle work. So, what kind of things should a therapist be saying to someone rather than, now you might feel some soreness tomorrow?
Yeah, that's a tough one. I'm not sure that I can think of it. I feel like this is something I would need to give more thought to in terms of how I would phrase this, but um, like how to turn that from a negative statement into a positive statement. Um, because the focus on that one does seem to be around discomfort and soreness.
Yeah.
Um, and I'm
I mean,
not sure how you could properly advise somebody about that without using those words.
I can think
Um,
of one or two ways. I mean, one way would be to finish on a positive. So, if you felt it necessary to address this, so let's start there. If it's necessary to say to the massage recipient that they might feel some soreness, I think the way to do it would be to say, now you might feel some soreness, but that's not necessarily a bad thing. This is part of the process of your body recovering, or this is part of the process of your body uh, getting increased flexibility and processing the work that we did today. Now, I might not be technically correct there, but the point I'm trying to illustrate is that it can be framed in a positive way, or it can be
and
framed
the
as part of a positive. Go ahead.
and the writer of this article would say that you just used the word but appropriately.
Oh, okay, good. I thought I'd made a mistake. I thought you were going to say that he would
No,
have.
no, he does go out of his way to say that there are times, because that was also one of the traps, is using don't and but, and
Yeah.
that there are times when using but can be good, and saying you might have some soreness, but
Yeah, the
it
word but,
separates those statements from each other, right? Where
right.
it
The word
it
but is
creates.
so interesting because it so often does signal something negative is about to come. I mean,
Yes,
the classic is, I love you, but, it's like kind of
yes,
like,
yeah.
oh, you don't really love me. Okay.
And that
But
what came
it is
before it
sometimes
is what came before it is not related to what came after it,
right. Right. It's not a
right? And so by
contingency.
saying
It's
yes, and so by saying but in that instance, I think you're creating that separation of saying this is a possibility, but, and then by you sort of divorce them a little
yeah.
bit, right?
So you might
Um,
have some discomfort, but the more important thing is that you're going to be on your
correct.
way to feeling better. Okay.
Yes.
Yeah.
Yeah. So
And then
that
there's
might.
the other there's the other classic thing that we get, I think, more down here in the States than in Canada, but maybe I'm wrong, which is the directive, now make sure you drink 8 glasses of
Oh
water
no.
today. So to me, that falls in this category, forgetting the fact that it's almost certainly wrong or unnecessary. Forgetting that fact, I mean, it's a directive. Let's say
Yeah.
what's wrong with that. Let's just cover the whole thing. The massage is done, and the massage therapist is like, now remember to drink your 8 glasses of water today. What's wrong with this?
Well, there are some people here in Ontario that would say that part of what might be wrong with it is that it might be out of our scope of practice, that it constitutes nutritional advice, and
Okay.
that is outside of our scope of practice. So that is, I would say, when you're going to go on the scale of wrongness, would be at the top of the scale of wrongness, like the most serious or egregious offense would be doing something that's
Yeah.
outside of your scope of practice. Um, the other, I mean, again, apart from, you know, evidence, approach says drink when you're thirsty, right? There's nothing happening physiologically during this process that should mean that you should have to consume. Um,
How
so
how how about the implicit messages? So I mean, I agree with you. There's probably no physiological reason the person's going to need a lot more water, but given what we're interested in today is the implicit communication and the possibility of a nocebo. What are some of the implicit messages that come along with, now be sure to
sure,
drink 8 glasses of water?
say
Any thoughts on that?
probably, I would say for me, the association with that would be that newest to my body just happened,
Yeah.
right?
Yeah.
Because for me personally, I associate consuming water with strenuous, because I'm most likely to drink water at a time when I'm doing some sort of strenuous activity. So I would think my body has just undergone some strain of some sort.
Right.
So that would be my first. I know that my thought process does not go here because I'm not susceptible to this understanding. But I know there are some people who think, immediately think about some kind of toxin situation where I've had this massage and stuff has been released in my body now that I need to get out of there lest it kill me. I don't know
Right.
what they're thinking is going to happen with that. But so I'm sure that there are some people who may go that way. And I'm sure there are still some massage therapists in Ontario who tell their patients that, unfortunately, that that's why they need to drink those 8 glasses of water
Yeah,
after they've had this massage.
I think it communicates the likelihood that the massage was some kind of ordeal, and that it's an ordeal that's
Yes.
ongoing in the person's body, and that something like really abnormal has happened. And yeah, I think all of that. And I think being aware of that general principle is important, that treatment providers not be inducing this idea that you've been through an ordeal or we've done something abnormal. I mean, obviously, if you've got information that they need, you need to communicate that. And however, it seems to me that these cases are really much more about the therapist trying to find a way to feel important or to feel
Right,
powerful than they are, even if it's at the expense of the patient or the recipient.
right. Um, and I just had a thought that just slipped my head.
Well,
um,
it
something,
came to you or it left.
something that you said just like 2 sentences, 3 sentences ago triggered something, and it literally just left my brain.
Oh, well, maybe it'll come back.
Sorry,
That's all
sorry.
right.
It was going to be amazing, whatever it was. It was fantastic.
It
It
might
was
come back.
life altering. It's
Did
gone.
your did your massage training include any coursework or exercises around verbal communication, or were you just expected to figure that out or pick it up on your own?
That's an interesting question. Um, trying to, it's a bit of a stretch for me. That was like 2009 to 2011. So we definitely talk about communication, um, ways of like all that. I would say most of the stuff we got was related to things that you already knew if you had any sort of training from some kind of like, I don't know, anyone who's ever taken a course on how to be interviewed for a job, those kinds of
Right.
things. So things about around how to have positive body language when you're having a conversation with someone. I would say the focus tended to be more on that. How to
Hmm.
present yourself as open, how to present yourself as, um, you know, just simple things. Don't cross your legs, don't cross your arms, like all of those kind of basic things. We certainly did not talk about nocebo language. Absolutely 100% we did not. Again, I feel very confident in saying that.
Interesting.
Um, yeah, it was. In fact, I don't ever remember the phrase. I didn't learn the phrase left school, so that was not was ever. I think I had some concepts in my head um, about it. About I
Sure.
think I understood that what you say, what you do, things that may or may not be present in your space can have that effect. But I didn't have anything to pin it on. I didn't have
Hmm.
a word to call it. I didn't know that it was a thing. I
Hmm.
just thought it was something I had a vague understanding about.
Interesting. So
Yeah.
so even though the massage education that you get there in Toronto, that you get there in Ontario is some of the most comprehensive that we're aware of, you didn't have any specific curriculum on this. That's interesting.
Yeah,
And that
it
tells me,
definitely
yeah,
was not something that came up. Yeah.
interesting, interesting. So there
Yeah.
probably is, I mean, I'm just
You
thinking to
also have
myself
to
now.
understand that we're not, now I speak also from coming from someone who has a private college education versus we do have community colleges here in Ontario that deliver a massage therapy curriculum. Their curriculum may be different.
Sure.
So it'd be interesting I do know some people who are teaching in that system. It'd be interesting to know if they are approaching any of that from a different view. Um, and I emphasize that point only because to a certain extent, very similar in the US, a lot of the private colleges thrust is on getting you through your certification. So
Right.
Nation involves a lot of, when you're talking about communication, you're talking about a template of communication, right? These are the things that they want to hear you say, right?
Okay.
There was a lot of room for nuance in that.
So the emphasis is on content when that is addressed.
Correct.
Yeah.
Yeah, and you can often watch people during a practical examination at school, when they're going through their informed consent with their hand down at their side, they know there's 10 points they have to cover and they're ticking them off on their fingers, right? Because
Oh, wow.
they know that there's someone with a clipboard ticking those things off. Have they asked all of these 10 points that are necessary to complete this task, right? So
Interesting.
you end up with a lot of people who give an informed consent that sounds very rote,
Hmm.
and sounds not very natural, which
Hmm.
is also not a nice way to interact with a patient, right?
Yeah.
Um, and then I did remember what it was I was going to talk about.
Oh, go ahead.
it was somewhat totally unrelated, but um, when it was about the expert conversation we were having
Mhm.
about this expert assertion that we were talking about. Um, I think the part that I had two sort of clinically relevant ways that I was looking at that expert assertion was um, this idea of the story that this person was telling about what happens when a provider refuses to believe something that they see, right? It was this story about the woman who had multiple sclerosis that was symptom free, but
Oh, right, right.
her imaging was saying otherwise. And this provider said, there's no way you can be feeling this good with an MRI like this.
Yeah, yeah, that was a
And
alarming example, yeah.
yeah, except we hear this all the time, right? Like this is, I undo, and I really sort of, I think, connected to the person writing this article saying that it took them weeks to repair the damage that this patient felt as a result of hearing that. I repair a lot of that damage in my practice from
Mhm.
other providers and from physicians. Um, and it sometimes relates to what another provider or physician has said to them. So they come to me, they repeat this language to me, and then I try not to have a look of horror on my face, and then I try to undo it. Or I see it sometimes with people who come to present to you an X-ray or an MRI report, which we sometimes receive, um, where they've interpret this for them. And they are internal narrative related to this may not be related to the reason as to why they're there, right? Or may
Right.
not be related to their painful problem. And so um, I really, I sort of resonated with that. And I think I don't know if it's the flip side of it, but also sort of in conjunction with that conversation is a conversation that some of my colleagues and I have had a number of times, this idea of how do you have a conversation with a patient knowledgeable and sound like you are confident in what you're saying,
Mhm.
but you are not using terms that might be nocebic. So sometimes arthritis is a good example of that, right?
Mhm.
Is it nocebic to tell a patient you have arthritis, as far as I'm concerned, right? Um,
Yeah.
or is it better to say, to come up with a way to say that that's maybe just more descriptive of a symptom or more, right, as opposed to, like degenerative disc disease is the other one, right? Like
Mhm.
that's a diagnosis, right? So
Mhm.
for me, that you have degenerative disc disease based on this MRI report, that's nocebo. But I've had a lot of
So
other
so
colleagues
there's
say,
a
well, no, I want to convey to them that I understand this diagnosis, and in a way that becomes an expert assertion, right? I am by
right.
this, right?
So I don't think there's a problem. I mean, if I can jump here, I don't think there's a problem with expertise all by itself. So the examples you're giving, I mean, one thing I see so many massage therapists on forums and such quick to note, we're not in a position to diagnose. And it sounds like without disregarding that, you might even receive information from the person themselves or from their physician or their surgeon or whatever that they have. Let's keep using the example arthritis. Can you um discuss that with the person, be factually correct, and still avoid inducing nocebo effects and maybe even induce placebo effects? So, I mean, I think there are some ways to open that door. Okay, it may be true that your rheumatologist has diagnosed you with arthritis, but that doesn't mean that the course of this illness is known, or that doesn't mean that you're going to have severe joint pain, or okay, you've been diagnosed with arthritis, but the treatments that we're going to do may help to stave that off a great deal. I think there's ways to finish that in a way that's positive or that's at least hopeful while still being accurate. I mean, you don't want to be like, oh, arthritis is no big deal, or I don't even think you have arthritis if there's evidence that they do, right? So I mean, you can't lie to them, or you certainly don't want to do that.
Right.
But opening that door up to, positive possibilities. And again, you can't lie there either. You can't be like, we're going to fix you all up. You're going to be fine. But doing it in a measured way, that I think the massages we give you are likely to, help you be comfortable, or liable to help you avoid a lot of discomfort with this condition. That example in the article was just so alarming. And I think it illustrates so many interesting things where this neurologist, is looking at the person's MRI. The patient is saying, I feel pretty good. And the neurologist says, you can't possibly feel good given what I'm seeing in this brain image. Right. I mean, that's wrong on like 4 or 5 different levels, it seems to me. I
And
mean, one is these.
when I
Go ahead.
read that, like I said, it resonated with me because I hear this in practice all the time of patients
Wow.
coming to me with other providers, not quite as horrible things to me,
Yeah.
given patient, we have my patients, which is, that's the worst of this I've ever seen, or yes, you have the tightest blah blah blah, blah treated, right? They come to me with some version of that, but I wondered after I read it, giving this physician the benefit of the doubt, it was weird attempt again at validation. Really define the odds here. Like, you
Oh, I
feel
see.
great, but this says otherwise, right? Like, I wondered if it was just a weird way of on the back
Well,
saying,
you're
good for
being.
you.
I think you're being very hopeful there. I mean, I
I know, like I said,
yeah, I don't think it is that. I mean, it would be nice if it was. The way I saw that example, and I think these things do happen. Well, I know they happen in medicine, where that neurologist is more focused on his expertise and the data that he is seeing and that he understands, contrary to what the patient is reporting. I mean, it is possible for there to be damage showing up in an image, and for the person to not be experiencing deleterious effects from it. And he's
right.
just skipping over that, and he's making it about him. He's making it about his expertise. He's
And I
placing more
think,
important. Go ahead.
I think, it's somebody who has two things in front of them, right? They have some what they're going to call objective information, which is a scan, and they have this person in front of them. Somebody who can only think of the one thing, right? They've
Right.
get this MRI. I'm not trained to
Right.
listen to what you're saying to me, right? So I'm telling you what I'm seeing, and you're telling me this other information that doesn't compute. And so I, given the role that I play, I choose to ignore this and focus on this, right?
All that, and then there's even a level beyond that, which, if you think about it, is just absurd, because in that example, the only person who knows how the patient feels is the patient. The
Yeah.
patient literally cannot be wrong on this. And yet you have the physician saying, you're wrong. I'm looking at your brain and I can see you don't feel the way you're telling me, which is
Right.
just, is absurd. So yeah,
And
I think.
I think that we get the same thing here with, and it's what I try to get my patients to understand when they come to me with an MRI report or an X-ray report, is to say, you need to understand that the person who read this MRI, a lot of times they didn't even talk to the patient, right?
Mhm.
Like, it's a doctor in his home office who gets, 500 of these to read over a period of time, and pumps out his report, right?
Right.
So it's like someone looking at a photograph and explaining it to you in words, right? That's all you're getting. You're
Right.
getting nothing else. You're just getting a pure description of, this is what I'm seeing, and is it what I would expect to see or not? Right? It's completely separate from, like you say, how you're feeling. What is your experience of this? Right? It doesn't factor that in at all. And yet people are so about rolling that MRI into their narrative of whatever it is that way more weight than their own body experience, like you're
Right.
saying. Like,
Right. And we might, now that you're mentioning it, I think we might see this general problem increase as neuroscience becomes a bigger and bigger field that gets reported in the news more and more. I mean, neuroscience is a great thing. It's terrific. It's going to get more and more powerful, scientifically and medically in the years to come, without a doubt. And yet, there's sort of this fetishization of what it is and what it can do. And people lose sight of the fact that it's not, it can't get at a person's subjective experience. It's not the same as psychology. There's so much that it can't do. There's so many ways for it to be interpreted incorrectly. Um, that yeah, I think we're going to increasingly see people get even more and more hung up on what brain imaging actually tells us versus what its limitations are. Even as the
right.
technology gets better, it's always going to have certain limitations.
Yeah. And unfortunately, it does also seem to be in the hands of journalists these days to talk about it
Oh,
and report
yeah, well,
about
I
it.
mean,
And it's sexy and it's
yeah, this
exciting and it's,
well, and
yeah,
the stories write themselves, and yeah,
badly
no, we're
reported.
just, yeah, we're just going to see more and more of it. And I mean, it's a good thing in some respects, but I think it's going to be a bad thing in some respects as well, because as you were
Yeah.
saying earlier, for a lot of people, well, for everybody to some degree, it's very hard to bridge the knowledge that we have between the physical stuff and what we experience phenomenologically. And there's always going to be a gap between those two things. I don't think
Yeah.
we'll ever see that bridged in our lifetimes. We might see that gap narrowed a bit, but we're never going to see it filled in conclusively. Um, so yeah, it's easier for people to focus on the meat, and it's harder for them to focus on what's happening phenomenologically for people,
Yeah.
because it seems somehow less real, even though in some cases it's the realest, most important thing. Well, this has been a good discussion. I mean, I think this is a good article, and I think that as I expand this feature, I think finding articles about professional practice to sort of complement um, the articles that we focus on that are research articles is going to be a good way for this to go. So I want to thank you for helping us select this article and for participating today.
Thanks for having me. It was
My
fun.
pleasure. My pleasure. Really appreciate it. So, that'll wrap it up for today. Thank you, Terri, for joining us from the terrific nation that is Canada. There's a bunch of us down here who are a little jealous of you folks up in Canada these days for a number of reasons.
You're not
But
jealous right now because it's really, really snowing right now.
well, there's that. Yeah, I mean, I'm enjoying the sunshine here in Denver. But anyway, thank you very much for
Thank you.
joining us, and let's do this again sometime.
For sure.
Thanks.